Good morning, Mr. Scott. My name is Whitney Beyer. I'm going to be performing your full physical assessment today. Can you tell me your full name and your age?
Scott, 31.
Nice to meet you, Mr. Scott. Mr. Scott appears alert. His nutritional status seems appropriate for his age and body build. He appears well nourished. He is sitting upright with good posture. He does not appear to be stiff. He is moving easily. I do not notice any physical deformities. His facial expression is appropriate. He is attentive. He appears cheerful. His speech is clear. His personal hygiene appears well groomed. Okay, Mr. Scott, I'm going to begin my physical exam by looking at your skin. I do not notice any obvious deformities, tattoos, or piercings. Your head appears normal size and shape. I'm going to now feel your scalp. I do not notice any obvious physical deformities. Your hair is well distributed, no bumps or lesions. Can you please clench your teeth and stick out your tongue? Thank you. Next, I'm going to palpate your sinuses. Let me know if you have any pain or tenderness. We'll start with your frontal sinuses.
Tenderness.
And your maxillary sinuses. Okay, Mr. Scott denies pain. Now I'm going to look at your eyes. Your eyebrows and eyelashes on the eyelids are intact, no lesions. I'm going to examine your conjunctive eye, which is pink and moist. No injection or cobblestone. I'm going to look at your scleria, cornea, and iris. You have blue eyes. No inflammation or drainage. Next, I'm going to test your corneal light reflexes with my pen. I'm going to come in from the side and the other side. Your pupils construct with light, and there is a light reflex. Okay, Mr. Scott, next I'm going to have you focus on my pen light without moving your head and follow the light. I am testing your 6 cardinal signs of gaze. Perfect. Your pupils are equal, round, reactive to light, and they accommodate. Next, I'm going to test your near vision. I'll have you hold this card about 12 inches in front of you, and I'll have you cover up your left eye. And I will have you read that sentence.
I went for a bike ride.
Thank you. And I'll have you cover the other eye. And I'll have you read what's on the second line.
I fell off the chair.
Thank you, Mr. Scott. It appears there are no issues with your near vision. Next, I'm going to look at your ears. I do not notice any obvious deformities, no excessive piercings, and your ears are intact. Next, I'm going to palpate your arcula and your tragus. Any pain or tenderness?
No.
Okay. And your other side, your arcula
No.
and your tragus. No pain or tenderness. Perfect. Next, Mr. Scott, I'm going to look at your nose. Your nose appears symmetrical to your face. I'm going to palpate your nose. Any pain or tenderness?
No.
No? Perfect. Next, I'm going to cover up one ear and have you take a deep breath and out. And the other ear. Thank you. Mr. Scott's ears are pink and bilateral. Next, I'm going to take a look at your mouth. Your lips are pink, slightly dry, but no lesions or cyanosis. Can you open your mouth? Your tonsils are 2+. You please say ah. Your uvula is midline and symmetrical. It rises and falls. Next, I'm going to take a look at your neck. I don't see any lesions. Can you move your head up and down and side to side and the other side and the other side? I don't notice any issues there. You have equal bilateral strength. I'm going to place my hands on your shoulders. Can you push up on my hands? And back down. Perfect. They are nice and equal. I'm now going to palpate your lymph nodes. First, we'll start with your prearcula, your postarcula, your occipital, your posterior cervical chain, your anterior cervical chain, your tonsillar, your submandibular, your segmental, and your supraclavicular. I do not notice any obvious lymphadenopathy noted. Next, I'm going to inspect your carotid pulse. It's 2+ and 2+. Thank you. I'm going to palpate your trachea. It appears midline. Next, Mr. Scott, I'm going to inspect your back. I'll let you turn around for me. I do not notice any deformities or abnormalities. I'm going to place my hands on your back and I'm going to assess bilateral chest expansion. Please take a deep breath and out. Mr. Scott demonstrates equal chest expansion. Now I'm going to do a technique called tactile firmitis. Please say 99 as I place my hands on your back.
99. 99. 99. 99. 99. 99. 99.
Perfect. Thank you, Mr. Scott. They are all within normal limits. Next, I'm going to percuss your posterior chest. You can just breathe normally. Thank you, Mr. Scott. I do not notice any dullness or tympany. Now I'm going to assess the VA tenderness. Mr. Scott, let me know if you have any pain or tenderness while I tap you on your back.
No.
Mr. Scott denies any pain or tenderness. Now I'm going to auscultate your posterior lungs. Every time I place my stethoscope on your chest, I want you to take a deep breath in and out. Mr. Scott, your lungs are nice and clear. Now I'm going to look at your chest from the anterior aspect. If you could just turn this way. Thank you, Mr. Scott. I'm looking at your anterior chest. Looks like you have bilateral breathing. I don't notice any deformities. Now I'm going to auscultate your anterior chest. Deep breath in and out. Thank you, Mr. Scott. Your breath sounds are clear to auscultation. Again, you have good air exchange. Next, I'm going to inspect your pericardium. There's no obvious deformities. Next, I'm going to locate your PMI. It is midclavicular, fifth intercostal. I'm going to palpate. Okay, thank you, Mr. Scott. I don't notice any bruits or thrills, so I'm just going to take a listen. All right, your heart rate is regular rhythm with S1 and S2, normal heart sounds. Next, I'm going to look at your upper extremities. I don't notice any scars, birthmarks, or deformities. Your capillary refill is less than 3 seconds. Your nail beds are nice and pink. I'm going to check your radial pulses. Those are 2+. Next, I'm going to have you demonstrate range of motion. I'll have you put your arms out and to the side and up. Thank you, Mr. Scott. There are no limitations to your range of motion. Next, I'm going to have you lay down. I'm going to inspect your abdomen. I don't know any abnormalities. Your abdomen appears flat without any lesions, scars, or bruising. I'm going to auscultate your abdomen. You have bowel sounds present in all 4 quadrants. I'm going to auscultate your aorta for any aortic bruits. And there are not. I'm going to percuss your abdomen. And now I'm going to palpate lightly. I do not note any tenderness. I'm going to palpate a little bit more deep. I do not notice any abnormalities or any issues there, any pain or tenderness. Perfect. Now I'm going to move down to your legs. I do not know any edema or bruising. Good hair distribution. A few scrapes, but nothing out of the ordinary. All right, I'm going to feel your duralis pedis. Those are +2. And your posterior tibialis pulses, which are also 2+. They are within normal limits and they're equal bilateral. Next, I'm going to have you do range of motion of your hips and your lower extremities. I'm going to have you bring your leg up, all the way up, straight, and then in. I'm going to have you abduct, and then adduct, and then back up, and down. Any pain or tenderness? Perfect. And now the other one. We'll have you bring your leg straight up, and bring it in, and abduct, and you can straighten it, and back down. Any pain or tenderness? Perfect. Next, I'll have you sit up for me. Thank you. I'm going to have you close your eyes. I'm going to touch you with this cotton ball. And you tell me where it is that you feel this cotton ball touching, okay? So I'll have you close your eyes.
My left cheek, right cheek, my right forearm, muscle, my right forearm, right hand, my left bicep, my left forearm, my left hand, my left knee, left shin, left foot, right knee, right shin, right foot.
Thank you, Mr. Scott. He demonstrates superficial touch on his face, upper extremities, and lower extremities, and bilateral. Next, we're going to test your cerebellar function. I'm going to have you put your hands out. And I'm going to have you pronate and supinate. And a little faster for me. Perfect. Next, I'm going to have you put your heel here and rub it down your shin. And back up. And the other one. Mr. Scott coordinates movement. He coordinates, his coordinate movements are equal bilateral. Next, I'm going to test your reflexes. First, I'll test your bicep reflexes. Thank you, Mr. Scott. You can just rest your arm down.
Gotcha.
All right, and your plantar reflexes. Okay, next I'm gonna have you walk across the room. I'll have you walk this way. Perfect, and I'm gonna have you do the tandem walk. I'll have you walk heel to toe across the room. Perfect. Next what we're gonna do is the Romeridge test. I'll have you stand right here so we can evaluate your balance. Can you please place your feet together? I'm gonna have you put your arms at your side and then extend them up. And I'll have you close your eyes and lift one leg up and balance. Perfect. And I'll have you do the same with your other leg. And close your eyes. Perfect. Mr. Scott demonstrates good balance. Lastly, I'm going to have you do range of motion on your spine. I'm going to have you bend forward and backwards, and then side to side. And then I'll have you twist. Mr. Scott demonstrates full range of motion, and he does not appear in pain when doing so. This concludes our head-to-toe assessment. Thank you so much, Mr. Scott. You have a good day.
You too.